Let's move on to working group number 4, equitable access to quality healthcare.
Et pour ce groupe de travail numéro 4, j'ai l'honneur d'accueillir sur ce plateau
I am happy to welcome Runa Khan.
Welcome. Je vous laisse vous installer. Merci beaucoup. Vous êtes fondatrice et directrice exécutive
Runa
de
Khan,
l'ONG
you
Friendship,
managed and you founded and managed Friendship NGO in Bangladesh. I will be back with you in a second, but we have other guests like David Heymann, who is a doctor, epidemiologist, professor at the London School of Hygiene and Tropical Medicine. Hi, David. David Heyman.
Vous m'entendez? Bonjour David. Vous allez souligner pour nous l'importance.
You will underline the importance of world access to healthcare.
Thanks very much. Yes, I'm very happy to talk about equitable access to healthcare because nothing has demonstrated the need for this more than the West African outbreaks of Ebola in 2013 and 2014. This was an outbreak caused by an emergence of the Ebola virus from the animal kingdom to humans that first caused a localized outbreak of Ebola. That outbreak was then amplified in healthcare settings by failed infection control measures. They resulted in spread of the virus to patients being managed in the healthcare facilities for other conditions and to health workers themselves, who then inadvertently infected their family members and others in their communities. And when health workers became sick, they were not able to obtain health care that could have saved their lives, nor could their families and neighbors, because their health facilities could not cope. Contrast this with the health workers of the international teams who supported the West African countries in containing the Ebola outbreak. If they became infected, they were rapidly transferred to hospitals in their home countries, and most of them survived. Inequalities in access to safe and effective healthcare could not be more clearly demonstrated, and they must be rectified. But the scenario in West Africa is not the only example. The Middle East respiratory syndrome virus, MERS coronavirus, periodically emerges from camels to humans. It rarely spreads from human to human. Yet, in South Korea, when one infected person who traveled from the Middle East entered a hospital with unsafe infection control, over 200 persons became infected and over 30 died. And when health workers became infected with SARS coronavirus in 2003, they inadvertently amplified transmission and spread the disease to countries around the world. I think you'll agree that an important challenge for those who work in the area of one sustainable health is how to decrease the risk of emergence at the animal-human interface and how to ensure equitable access to safe healthcare for all. But there's another very important area concerning equitable access to safe healthcare in animal and human health, and we heard about it earlier from Professor Andermont and others: antimicrobial resistance. Resistance of common disease-causing bacteria in humans, animals, and the environment occurs because of our own behavior in demanding antibiotics from healthcare providers, the behavior of doctors who use and overuse antibiotics in treating humans, the behavior of veterinarians who provide antibiotics to help compensate for infections caused by careless animal raising practices, and the behavior of farmers who spray their fruit and vegetables with antibiotics to prevent blight. Examine groundwater or sewage in any country, and you will likely find antibiotic-resistant bacteria that eventually make their way to humans, animals, fruits, and vegetables. Today, the challenge is SARS coronavirus 2 and COVID. Tomorrow, it will be other unknown infectious diseases. But the problem of antimicrobial resistance will continue, and it needs innovative solutions to preventing infections in hospitals and in humans, animals, and the environment. I believe you will agree with me that Working Group 4 has many challenges to address to ensure equitable access to safe healthcare. Thank you.
Merci beaucoup, David Heyman, et nous sommes effectivement d'accord avec vous pour.
Thank you very much, David Heyman. Indeed, there are several challenges, and that will be the hard work of group number 4. We are now with Wilm, Quentin. You manage the Global Health Center at the University of Berlin, and you are a member of that group number 4. What do you have to say about equitable access to quality healthcare?
Yes, thank you very much for the invitation. As a researcher, I've worked a lot for the European Observatory on Health Systems and Policies, which basically aims to support evidence-informed policymaking to strengthen health systems in Europe. And the aim of strengthening health systems is usually to assure equitable access to quality healthcare, apart from making health systems more efficient and more cost-effective. And this work almost always involves research that will support strengthening health systems in Europe, but then also to talk with policymakers to make sure that this research reaches the ears and eyes of policymakers. And at the same time, my ambition as a researcher is to also contribute to strengthening health systems in African countries. And I've led several projects that aim to strengthen capacity in health systems and research and management in Ghana and in West Africa more generally. Now, the goals of the International Working Group number 5 are very much aligned not only with my own ambitions as a researcher, but also with international efforts to achieve universal health coverage, which is target 3.8 of the Sustainable Development Goals. And achieving universal health coverage means that all people should have access to high quality care without being exposed to financial hardship. And these are the two aspects of universal health coverage. And because this is the case, the aims of International Working Group 4 are very much aligned with international aims to achieve universal health coverage. And to achieve universal health coverage, it is necessary to think more broadly at the system level about how health systems can be strengthened. And in many countries of the world, achieving universal health coverage will require increasing public funding in order to expand public coverage schemes and to make sure that everybody has access to care. And this means that on the one hand, health insurance needs to be extended to the uninsured, that all relevant essential services need to be included in public benefits packages, and that also countries need to get rid of excessive user charges that prohibit equitable access to care, even for things that are in theory covered by public healthcare systems. And in addition, in order to improve quality of care, because it's not enough to only assure access to care, it is important to strengthen those quality governance systems, to expand human resource capacities, to assure availability of technologies and infrastructure, and to explore the potential of digital technologies in contributing to improving quality, but also the potential of digital technologies that can strengthen public coverage schemes by supporting public financing for healthcare. So in general, in conclusion, without strong health systems that are designed in line with principles of solidarity, it will be impossible to assure equitable access to high quality care. And I believe that International Working Group number 4 needs to study these aspects of how to improve coverage and how to make progress towards achieving UHC in order to assure that we will achieve equitable access to quality care for all.
Merci beaucoup, Wilm Quentin, chef du département de santé.
Thank you, Wilm Quentin, head of the Global Health Department at the University of Berlin.
Serge Breysse, bonjour.
Serge Breysse is our next expert. You are the Directorate General for Soltis NGO. What is Soltis?
Bonjour, merci. D'abord, je voulais remercier
Thank you to all the organizers for the invitation. Thank you, Benoit. Soltis is an NGO in West Africa over the last 20 years over AIDS challenges and infectious challenges and sexual health as well. It is an important group. We are aiming at everyone having access to quality healthcare. We have a concrete vision. We are in the field, and we believe it is important for everyone to have our return of experience. We are committed to working on this project because we know the fragile, isolated populations suffer from bad practices and climate change. It is important to prevent, and we must all work, and this is why it is important to recognize the role of civil society at the community level. And you will see in a video that you will watch later in the program that we have developed with our partners. We are developing a modern approach. And we are aiming at working with all health actors. The current crises are multifaceted, and consequently, we also want to work on efficient responses to how to aid countries and reinforcing the work of national actors. Obviously, all this must be people-centered, and that will be all for me, and I yield the floor to Runa. Thank you, that's a great transition. Thank you, Serge, Managing Director for Soltis. Okay, we have seen several initiatives in order to facilitate access to quality healthcare, especially in Africa. I would like to take you with me to Bangladesh with you, Runa Khan. Your video will present your NGO, Friendship in Bangladesh. How will you work within that fourth group with the different experts we have already heard?
So, Friendship, we have been working with an integrated system, which is one sustainable solution, really, for 20 years. And, we have learned, from this shared human crisis now, that human health is interlinked to all life, man, environment, animals, impacting dignified survival for all on this planet. And we all have a right to this planet, and humans, the most prominent force, need to accept this respectfully. OHS is a collaborative platform for verbalizing this already proven approach scientifically, and for better acceptability and understanding of the actors who are working on this, scientists to decision makers, who are all striving, needing to understand its importance and to do this sustainably. It's very important. And for us, the term sustainable gives rise to a whole range of interpretation, from finance to continuity. But in reality, it refers to the integration of action to care for human, animals, environment in an equitable balance and on this planet. And this will ensure health and dignified survival for all living beings. And we need to continue the interlink of all needed elements for this survival and this sustainability, all that we see around us, so that health is not an element, which is addressed dramatically when a crisis arises or in isolation. But healthy life becomes an outcome of a way of life, of living, of hope, of dignity. And this is, I think, the strive of One Sustainable Health. And I think when Benoit started this and we kind of all were on the platform for starting this work, it was what I have been striving for 20 years. So for me, it was really like a dream that we could bring this platform to the world, and the world would note the importance that health doesn't, is not acceptable only as health, but in a platform for the whole ecosystem.
Merci pour ce message d'espoir, de dignité.
Thank you for this message of hope, of dignity, and for us to realize your commitment over the last 20 years. I would like all of you to watch a report on your NGO Friendship in Bangladesh.
Et ces très beaux sourires d'enfants que l'on voit dans ce
Beautiful children's smile.
Merci beaucoup, Runa.
Thank you very much, Runa.
Est-ce qu'on peut mobiliser, vous
How
avez dit cette
can
urgence de
you
mobiliser à
bring
l'échelle
people together? How
et quelque
can
part
you
de ne
have
plus être
people
seulement dans des projets, on peut aussi
committed
merveilleux soit-il,
to
donner cet exemple.
to this project?
I think one needs a very strong vision. And in this journey of this vision, you can never work in isolation. You only work and you only deliver and you only achieve when your vision can become the vision of all those, who are working with you. Not only of the people working in the organization. I have about 3,000-4,000 people in the organization, but also the beneficiaries and also the stakeholders, and most important, this global team that we have in Friendship International, Friendship France, Luxembourg, Belgium, UK, and Holland. And we are all together. We are a global team. It's not North and South. And I think spreading this has been, I think that the result has been because this has been done with verity. It has not been done just because I spoke about it, but the work, it was shown, and it is only by seeing you understand reality, and verity is a very important word for that. It's not only truth of the work, but truth of the way of work. When I say that we work with values, it means that all our decisions are based on the values. They are not our limiting factor. They're the very essence on which we work and how we plan. And I think this is what has brought the global team together.
Merci. Cet appel est lancé pour donc une vision globale.
Global vision. We are all together. Thank you, Runa, founder and director of Friendship.
De ce groupe, de cette présentation, parce que ce n'est que le début du travail de ce groupe.
End of the presentation of group number 4.
Comment rendre équitable l'accès à des soins
Its theme being how to generate an equitable access to quality healthcare. The different experts that we have met is David Heyman, Wilm, Quentin, Serge, Breysse, and Runa Khan. Thank you to all of them.